Hi, everyone, and welcome to the World Doc Allen podcast. I'm excited to welcome to the program World Doc Allen Lindeman. Doc, what's going on, man? How are you?
We're doing really well, Neil, and you?
I'm doing fantastic. In today's topic, strep throat and pregnancy. What are some of the symptoms of strep throat during pregnancy?
Well, like when you're not pregnant, strep throat is probably the most sore throat you will ever have in your life. You'll also have a fever, and you'll probably have some swollen glands and a headache.
Will the symptoms be different if you are pregnant?
Nope, not at all.
How can you tell the difference between strep throat and a cold?
Well, with a cold, you have a runny nose, stuffy nose, cough. Your fever won't be as high. You won't have so much headache. And of course, with the strep throat, you will have a high fever, a very sore throat, and a headache.
What are the specific risks to pregnant people if they get strep throat?
Well, there's nothing in particular with a strep throat in pregnancy. Of course, as soon as it's diagnosed or as soon as they come in, you should treat them, and the treatment is penicillin.
What should parents know about strep throat versus group B strep? Is strep throat dangerous to infants if the birth parent has it and at delivery? Can it be passed to the baby?
Yes, it can be. And, you know, one of the problems we had with group B in the first place is that not every baby who comes in contact with group B gets it. And not everybody that gets it gets sick. So anyway, parents need to know that they should have some kind of treatment. The present treatment, of course, is penicillin when they are in labor and ruptured membranes.
Okay, what are pregnancy-safe strep throat treatments? What antibiotics can pregnant people take?
Well, penicillin is really safe. It's almost as safe as water. If you can't take penicillin, then there's Rocephin that can be given IV, and these are good for moms in labor.
How to prevent strep throat in pregnancy? Are pregnant people at increased risk of contacting strep throat?
No, they're not at higher risk than anybody else. But of course, one of the problems with pregnancy is that you have this immune state. In other words, the mother's immune system has to be turned down a little bit to tolerate the baby, which is only half her and half dad. So it's possible that the strep throat could get to be more complicated in pregnancy than in the non-pregnant state. I would personally, anytime somebody comes in with a strep throat, fever, and swollen glands, I treat them for strep even before the culture comes back.
All right, the best place to go is worlddocallen.com and safepregnancy.com. Appreciate it, Doc.
Thanks, Neil.
All right, that was the World Doc Allen podcast, guys. Take care.